The effort to vaccinate Americans has been speeding up, which is good news. The CDC says more than 62 million Americans have been fully vaccinated so far. But many people across the country still run into problems signing up for that shot, whether it's due to a lack of internet access, confusing websites, or appointment availability. All of these problems mean many vaccine sites are left with extra doses at the end of the day. And while distributors do what they can to use up the surplus, in some cases, the vaccines go to waste. One New York-based startup company is working to change that. Dr. B is a web service matching people to vaccine providers with leftover doses. Joining us now is the founder of Dr. B, Cyrus Masumi. Cyrus is also the founder and former CEO of ZocDoc. Hi, Cyrus. Great to see you. So tell us a little bit more about Dr. B, how it works, and where it's available.
Sure. So we started Dr. B because, as you mentioned, patients are actually canceling or no-showing on their vaccine appointments 20 to 30% of the time. And that's resulting in a last-minute scramble that's happening in vaccine sites all across the country. That's resulting in vaccines not going to the optimal people who need them, or in the worst-case scenario, going to waste. So we started Dr. B to be a universal standby list for anyone in the country to sign up. And they simply indicate where they are, what they do, and some of the healthcare background that was required by the various state criteria. And anytime a vaccine provider has an available dose, they simply indicate how many doses they have and when they expire. And Dr. B will then programmatically text message the appropriate number of people in that local area based on the original local government priority criteria to make sure that every single dose is optimized. And I think that one of the most critical elements of this is that we're still going by the original local government priority criteria. So if you were previously vaccine hesitant and you would have qualified because you're 65 and over, and now you're deciding that you want the vaccine, we simply will put that person in front of the queue. So it works like a first-class ticket. They don't have to worry about refreshing 1,000 times a second.
So even if the state eligibility age has been lowered to, let's say, 30, or in some cases 16, we've seen it that low, if you're 65 and you haven't gotten your shot yet, you get on the front of Dr. B's list. It's interesting because, you know, I know a lot of people here in New York who signed up on your list. I signed up before I was eligible in New York State. I never got a call, though. Now, of course, the age has been lowered in New York State so that I can get a vaccine. How many people have you been able to actually call and help get a vaccine off of your list?
So we launched Dr. B in a couple of pilots 4 weeks ago in 2 states, in Arkansas and New York. And since then, we've added nearly 130 vaccination sites that span 29 different states. We have a goal of significantly increasing that. In terms of the actual patient counts, I don't have the latest, but I will tell you that more and more people are being vaccinated every day, and we're just trying to roll this out in as many places across the country as possible.
And what has been the overall reaction to this service, both from the public and the health sector?
So from the public, I've been on site at a few of our vaccination sites, and what was heartwarming to see was that the people who actually were the first ones notified were people who actually needed the vaccine. They were perhaps health workers who were not part of a large health system, so they were just left behind in the first wave. In one case, it was a woman who didn't speak English. She only spoke Spanish, and she was over 65, and she wasn't able to navigate the complexities of the websites that were available to her. So that was very heartwarming. And on the provider side, this scramble is really something that's affecting pretty much every vaccination site. And people are having to stay late because they want to make sure that every single dose is going into an arm. And it is spending hours calling people to see who might be available to take these excess doses gets replaced by a system that does it automatically within seconds. It's been a huge time saver. And so as a result, the number of vaccine sites that have been coming to us have been growing just off of referrals from other people who work at other vaccine sites.
Now, is there a way you think that Dr. B can serve as a model for a more equitable way of scheduling vaccinations moving forward? I mean, now that we are getting to the point where it's almost a free-for-all, not quite, but pretty much in many states, as long as you're over, 16 in some states, 30 in others, you can pretty much schedule a vaccine for yourself. There, of course, are still people in those vulnerable populations, as you pointed out, who haven't been vaccinated. So is there a way that Dr. B can be used on a more widespread basis to help those populations?
We're already seeing that. There's certain municipalities across the country that have actually decided that a queuing-based model is more equitable and will make sure that this most scarce resource on earth is allocated to the people who need it most. And so that's already started to happen. I think especially as vaccine sites realize that in order to vaccinate the entire country, you can't just expect everyone to be able to make it to a max vaccination site. You have to bring the vaccine to the people. And enabling mobile vaccination sites literally within minutes notice to say, we want to have a vaccination site here, let's immediately start using Dr. B to send patients to those areas. These are the different types of use cases that we're facilitating. And it's both more efficient and more equitable. And I think now that they realize that there have been so many systemic inequities that have been part of this pandemic, and to have a tool, a service that can help resolve some of those, I think has been very embraced by a number of public health officials and various vaccine facilities across the country.
Well, Cyrus Masumi, the brains behind Dr. B, thank you so much for joining us. We appreciate your time.
Thank you.